Hi guys, welcome to today's class. Today we'll be talking about analgesics. So what are these analgesics? They are drugs used to relieve pain without causing loss of consciousness. Relieve pain and without causing loss of consciousness. Those are the keywords we have here. They are commonly known as painkillers. So what are the mode of action? That is the mechanism of action. They relieve or eliminate pain by acting on peripheral or central nervous system. In the body, we have natural painkillers. They are called the endorphin. They act as natural painkillers. So these analgesics now mimic those natural painkillers we have in our body. And also this endorphin now stimulates the gating mechanism. So it's this gating mechanism now that is going to now block the pain from not reaching the central nervous system or the peripheral nervous system. This is what these analgesics do. So we have types of analgesics. We have non-opioid, we have opioid, and we have adjuvant analgesics. So in this non-opioid now, it is used to relieve mild or moderate pain. So we have the acetaminophen, also known as paracetamol, and we have non-steroidal anti-inflammatory drugs known as NSAID. This is where we now have ibuprofen, aspirin, and diclofenac, and so on. So we have opioid analgesics. So these are drugs now. These are analgesics, the type of analgesics used to relieve moderate to severe pain. Those one now that this non-opioid cannot relieve, you give opioid analgesics. And we have example, we have morphine, we have tramadol, we have fentanyl, we have codeine and others. So the next one now we have is adjuvant analgesics. This adjuvant analgesics now, their primary function, their primary role is not to relieve pain, but are used to relieve pain in some specific situation. Example, in neuropathic pain, we have amitriptyline, which is originally an antidepressant drug, but can also be used to relieve pain. We also have gabapentin. It is originally an anticonvulsant drug, but can also act as a painkiller, like also act as analgesics. So let's go to the over to indication when to use these drugs. You use it for headache, toothache, post-operative pain, cancer pain, that is musculoskeletal pain, either muscular pain or skeletal pain, menstrual pain. So this thing now is addition of all the analgesics, so both opioid and non-opioid and the adjuvant. So the side effects are, in non-opioid we have gastric irritation, that is another name for ulcer. So and liver damage, especially in PCM overdose. People don't know that PCM, paracetamol, is the most dangerous drug in this world because it actually lead to liver damage and you only have one liver. And even his kidney, at least if one damage, you'll be managing the other one. But this liver, if it's damaged, it's over for you. We have opioid drowsiness because it causes this euphoric feeling, especially this opioid analgesic, constipation, respiratory depression, and risk of addiction. You'll be hearing, no, give me that particular drug that you gave me. Give me that particular drug you gave me. That is, there is now risk for, it's not even risk, there is not addiction. So that is why it is kind of advisable that this opioid analgesics is not used for a long period of time. So we have contraindication, we have hypersensitivity. If this person, is sensitive to the drug, do not give. During pregnancy, don't give. Lactating mother that are breastfeeding, there are lactating mother that do not breastfeed, they can use it. But lactating mothers that are breastfeeding are not meant to use it. You have liver failure. If the patient has liver failure, do not give, because especially PCM, because leads to further damage to the kidney, kidney failure and respiratory disease. Because this opioid actually leads to respiratory depression. If you now give it to someone that has respiratory disease, you want to finish the person. So do not give. And anybody that have gastric irritation or ulcer, that is why if they want to prescribe drug for you, they'll ask you, do you have ulcer? So that they will know the type of drug to give you. Or even though they want to prescribe this analgesic for you, they're going to give you antacid. It's going to prevent gastric irritation. Why analgesic now do its work? Nursing responsibility in general. You now assess before you give this analgesics, you assess the patient pain level, you know, before and after administration of this analgesics. You watch out, you monitor for side effects. And that is why if you take opioid analgesic, do not work, do not operate machine, do not drive, do not operate a machine. So you have to rest for some time before doing anything. You educate on correct dosage and damage of self-medication. This is where this paracetamol comes in. Any small pain, headache, toothache, you go and buy paracetamol. So the damage of self medication is not as if you are not going to take it, but too much intake of the drug without prescription, that is self medication, is very dangerous. And maybe if they prescribed 1,000 milligram of PCM for you, you now go and take three. That is three tablets, which is now 1,500 milligram. You are doing harm to yourself. So use with caution in patients with liver, kidney, or respiratory diseases. That is, you reduce the dosage. If it is a must, you have to use this drug. In people with liver, kidney, or respiratory disease, you have to use in a lower dose.